Kids are really cheap to cover. When I was working on the CHIP program a few years ago, I think the average cost of a kid on Medicaid at the time, a non-disabled kid on Medicaid, the cost was around $3,000 a year, of which the feds paid 80%. So for the state, the cost to the state to insure a child was $150 or $1,500. I think it was $1,500. It was very, very cheap. You take 20% of $3,000 is $600. Thanks for the math. That's what it was costing this. That's what it cost the state. So it's kids are inexpensive. So that's where most of the kids are. Idaho covers persons with disabilities, whether it's serious mental illness or developmental disability. So we have coverage for people who have disabilities. Covers low-income pregnant women, but not very much. So if you're a pregnant woman, Medicaid will cover your pregnancy-related health care costs. But if you break your arm, you're on your own. So if you're a pregnant woman, it'll cover the health costs related to pregnancy and about a month or two postpartum just to make sure you're okay. But any health condition you have that can't be directly related to the pregnancy is not covered. So if you're a pregnant woman, you have partial coverage. If you're low-income elderly person, Medicaid can help cover the Part B premiums and can help cover some of the cost of care, but it's still pretty low income. If you're a parent of a child and your poverty level right now is about below 20% of the federal poverty level, so the poverty level for a single person in this state right now is around $12,000 roughly. So if your annual income is below $2,500, you might be able to get Medicaid coverage as a parent of a child. $2,500, yeah. So basically it's non-existent. And if you're an adult, low-income childless adult, you have no health insurance, and Medicaid doesn't cover you. So Medicaid in Idaho covers a whole lot of kids. Almost all of that 240,000 is in the child population, and little pockets of other folks. So it is a very narrowly targeted program.
I'm sorry, but when you talk about coverage, we're talking degrees of coverage. We're not talking 100% of everything.
When
like people with disabilities or...
Okay, so Medicaid rules, how much does Medicaid cover in terms of that?
Because when we say coverage, you could be 100% of everything to...
Medicaid tends to cover almost, well, see, first of all, Medicaid pays providers, Medicaid sets the rate to which they pay, which is in most cases equal to the cost no matter what a provider says. Because the provider charge and cost are different things. So Medicaid pays a rate. And if you're below 100% of poverty, it will pay 100% of that rate. There's no copay, there's no premium, there's no deductible on Medicaid. If you have kids under the Children's Health Insurance Program above a certain poverty level, there is sort of a premium that you have to pay. But if you do certain things in that program, you get an offset to that premium.
Do these include eyes and teeth?
Medicaid pays for dental for kids, some vision for kids, and it covers some very limited adult dental for persons with disabilities. Okay, so it's not a gold package by any stretch of the matter. Maybe
part of the problem is you may be covered by Medicaid, but for example, a child that needs dental service in northern Idaho, there is one dentist in Coeur d'Alene that will take that individual on.
Right, because that's the other part, especially with dental care. There are some dentists around the state that have figured out how to do that, but most dentists are very, very limited. The other thing you have with Medicaid is, as same with Medicare, many general physician practices will not take Medicaid or Medicare patients because of the payment. And so there are places that community health centers, rural health clinics, rural hospitals that have a provider-based health clinic can get a different kind of places that can get a different reimbursement, but most private physicians, especially family medicine, have a very limited number of slots that they'll use to take a Medicaid or Medicare patient. So just because you have it doesn't mean there's somebody there that wants to provide the service for you. But what happens now, out of a almost $2 billion appropriation each year for Medicaid, the federal government pays about $1.2 billion. So most of the payment for services comes from federal resource. The federal match, because we're such a poor state, out of every dollar that Medicaid spends, the federals match about 70 cents. If it's the Children's Health Insurance Exchange, it's 80% instead of 70%. So the feds pay quite a bit. And when you talk about how much of the Medicaid budget goes to paying for claims versus administration, and you know that's a big issue under the Affordable Care Act. The rules under the Affordable Care Act said insurance companies have to spend at least 80 to 85% of their premiums on paying claims. Medicaid spends 96 cents out of every premium to pay claims and has 4% administrative cost. Medicare has an administrative cost like that. So if you really want to take a look at administrative costs in the program, Medicare and Medicaid have very low administrative costs. Medicaid what are the basic things that Medicaid pays for? Hospitals, of course, long-term care, nursing home care. Medicaid is a big payer of nursing home and in-home care services, services to persons with developmental disabilities, with serious mental illness, physician services, prescriptions, and mental health services. So that's where the Medicaid dollars generally tend to go. So this is just another slide that looks at the Medicaid population that we've talked to and what the population was. Kids between Medicaid and CHIP are covered up to 185% of the federal poverty level. For both up until from 0 to 18, it varies by program, but it's basically up to 185. Pregnant women are covered up to 133 for pregnancy-related health care. Adults over 65, there's about 26,000 of those adults that are getting some Medicaid support to cover premiums. There's about 34,000 of people with disabilities on Medicaid. People with severe disabilities, about 16,000, and there's waivers to cover them up to 230% of the poverty level because the state has found that persons with severe disability, if you provide in-home care, it's still less expensive than providing care in a skilled nursing facility. And there's a few adults with kids, about 18,000, that are really so poor that they still qualify for Medicaid. But it's, you know, I don't know about any of you, but I think trying to figure out how to live on $200 a month so I could be Medicaid eligible, you know, everyone else in this state, if they have no employer-sponsored health insurance or have not bought health insurance, are basically uninsured and have to rely on safety net programs and charitable contributions and cans you see in restaurants asking for a donation or fundraisers. But that's who we do. So what is the Idaho safety net? One of the safety nets in this state, it's been around for a long time, is the County Medical Indigency Program. In Idaho, Idaho has a law that says the county is the payer of last resort for medical claims. And that varies by county, by county, by county. There are some counties that handle that pretty well, and they'll pay based on Medicaid rates. And some counties I know of that will have said to their little county hospital, we're going to give you $30,000 this year. Don't ask for a penny more. Don't file any claims. And don't come to us, and if you do, we'll just replace the board members with people that won't bother us. So there are some counties that do that. There are some counties that if you apply for medical indigency, the first thing they do is say no, and then see how serious you are about trying to do it, or how serious is the healthcare facility to try to get it. And there are bigger counties actually have systems in place, but the counties have put together a standard form. The counties require people to bring in proof that they're not Medicaid eligible, and then the counties will think about it. The counties pay the first $11,000 of a claim, and then after the county pays that 11, it goes to a state catastrophic fund board that takes a look at it, decide if they want to pay the rest. But it's basically a very retroactive service. There's nothing preventive about it. Essentially, it gets triggered when somebody ends up in an emergency room or a hospital bed and needs more intensive care because there was no preventive care done in the first place. And right now, those costs have strangled the counties and strangled the state catastrophic fund. I think between the two of them, they're spending $60 to $70 million a year now. And that's projected to go up to about $90 million in the next 7 or 8 years. That's all property tax and sales tax money. It's not matched at all by the federal government. It's basically $70 million. If you matched it, you'd have about $200 million. But that's the way we do it now. Community health centers exist in most places in the state. Community health centers serve people on a sliding fee scale and serve about 70,000 uninsured low-income persons every year. Half of those would be eligible for the Medicaid expansion. State mental health services. We've talked about mental health services and the total inadequacy of mental health services in this state and in this country. Right now, state mental health services are almost all funded out of state general fund dollars. About 4,000 people are getting services through the state mental health program funded out of state dollars. And Department of Corrections ends up paying for some health care costs for people that go through that system. So the other safety net is the emergency room. When in doubt, emergency rooms have to at least screen someone to determine their medical need and have to meet that need if they so desire it. Interestingly enough, if you look at the research, people who are uninsured, who show up in a hospital for care, receive less care for the same illness than a person who is insured, regardless of clinical need. It's just one of the facts. That is what it is.